Tack and floss is an excellent way to improve your range of motion quickly and decrease pain. We use it here at Mobility Doc for a variety of conditions, but it's especially great for any kind of muscular tension, especially when you're trying to move a limb, do an exercise, and you're experiencing difficulty. Difficulty in the form of tightness or pain. My favorite use case for tack and floss is overuse injuries that involve the bicep, the elbow, your calf, and your hamstring. Tack and floss is excellent, not just for injury, but also for improving mobility. Especially those of you who are trying to increase, say, your overhead position, like a weightlifter, a CrossFit athlete, someone who needs to be in an overhead position and has difficulty maybe because you've just never worked on being there. Tack and floss is also particularly great for a jiu-jitsu athlete or someone who needs a decent amount of hip flexibility and needs to be able to be in a certain position to be able to do a specific skill. You can use this as a very fast way just before you're performing a movement to get a quick improvement. Tack and floss does two things in particular. Tack and floss will tack down the tissue, as the name implies, and what that's doing is adding some compression to the area. The compression is good for changing blood flow. Think of it as a form of blood flow restriction where you are trying to stop inflammation and other pain mediators from coming into the area. Then when you take the floss band off, fresh, new, clean blood comes like crashing into the area, reperfusing or refilling the muscle with clean, healthy blood. The second part to tack and floss, the flossing aspect, is a form of active release technique. An active release technique is when you pin down an area of dysfunctional muscle or dysfunctional connective tissue, and then you go through a range of motion, and while you're going through that range of motion, you are breaking up scar tissue, adhesions, trigger points around the area to free up the way that the muscle and the skin can move around each other. This increase in blood flow and this increase in range of motion is what instantly changes the way that you feel, your pain, and your flexibility. When not to use tack and floss would be on an area where you suspect that you have an active tear. If you're not sure if you have an active tear and you haven't consulted with someone you trust in a healthcare role, what you can go by is, did your injury occur in the last 48 hours, maybe even 1 week? Is there still a whole lot of fresh bruising that you see in the area? When you tack and floss the muscle, does it get worse? Is it feeling better afterwards, or does it hurt more and more each time you do it? It shouldn't hurt more. It might hurt a little bit during, but when you take off the band, it should feel better. And as always, if you're unsure, you should consult someone like us, a Mobility Doc, to make sure that you're doing the right thing and you're gonna get the result that you're hoping for. So I'm gonna be using a Rock Floss tack and floss band. It's what we use at Mobility Doc. It's what we provide for our patients. It's just one of our favorites because it does exactly what it's supposed to do, and it's at a great price. I'm going to be tack and flossing my hamstring. I'm doing a seated. I'm going to show you how to wrap this. You're going to start either below or above your patella. I'm going to start below. You can do this based on trial and error. It's all about what feels best, what gets the best results. Remember, the hamstring in this case goes past the knee, behind it, so that's why I'm starting below the kneecap. So I'm going to lay the tack band down just like so. And this first one, I don't have a whole lot of tension because I need to be able to get a little bit of traction. Once I wrap it like that, then I can pull the band and get about 50 to 75% tension across the band as I pull it up my knee. I'm going to go over the top of my patella now, just above it, and I'm going to continue overlapping my band as I go, and just continuing up my leg. You should see your thigh in this case move under the pressure, the tension of the band, and that's how you'll know you're doing it right. Your toes may even begin to turn white at some point because you really are compressing a good bit and occluding or stopping circulation. One of the pro tip ways at the very top here is if you can, like a balloon, follow the band, tuck the floss band through there, then you get this nice sort of anchor point for the tack and floss. Now, once it's tacked down, we need to floss it. So in the case of the hamstring, to floss it, I need to stretch it. I need to move it. I could do that seated where I could stay upright. I could push my knee back and forth. I could bend forwards and backwards from my pelvis or my hips to stretch through this hamstring. I also like to stand and then literally just go through toe touches, coming up and down. What's important when doing this is that you have the band on for long enough that you make a significant change. And the way that you can guarantee or ensure that is to have it on for about a minute, no more than 90 seconds. This thing should come off. So I've gone through 10 repetitions of hip flexion, or I've moved around different hamstring exercises for 60 to 90 seconds. Now I'm just going to find where I anchored it. Never lose where you anchored it. I have done that. Panic ensues. Take the band off. What it'll feel like once you get that band off is like you have this rush of warmth coming down the leg because you've just allowed all that blood to come crashing back in, and that blood helps to heal your injury. That blood helps to bring all of the good things within your body back to the site where you hurt yourself. Or in the case of you're just trying to improve your range of motion, that tack and floss has now broken up the stiffness around the joint, allowing you to achieve a new and better range of motion. So to get more of the hamstring, you're gonna need to re-wrap up your tack and floss band and then start it a little higher. If you try to cover too much area too quickly, you're gonna spread yourself thin, and you'll see you won't be able to actually wrap the band nice and neatly over top of itself. So I'm just gonna restart this to show you how you can start now above the knee at about just below mid-thigh level. Same idea applies. I'm gonna put the band down first, get a little bite out of it so that way I can now pull. Once I feel like I have some nice bite here, I'm gonna get about 50 to 75% tension as I roll up my leg higher up into the hamstring. Hamstrings tend to be a little bit meatier than the rest of your body, so that's why it might take a few times working up the leg before you cover enough of it to make the difference you want. Remember, tuck the band underneath. You're gonna then repeat the same process where you're standing up, hinging forward at the hips about 10 times, or about 60 to 90 seconds. You can also do it seated. You could even do leg curls standing like this, working up and down this way. For those of you who are a little bit more further along and trying to maybe just improve range of motion, you could even have this higher up on the hamstring and perform RDLs with light weight or a little bit more weight in your hands. But anything that moves the hamstring through the band while it's tacked down is going to floss it and is going to improve it. Another pro tip is that when you want to reapply this band, make sure you roll it fully back into like a tight ball. Otherwise, when you go to apply it, you'll just be trying to like pull this strap for forever around your leg, and you'll just waste a lot of time and you won't be able to get a lot of tension. And for those of you with a little bit of hair on your limbs, you can do this also with like an exercise pant or a compression pant over top if you feel like you're ripping into your hair. I would do this every single day. If you want to see a change, you need to do this regularly. The more you do it, the better. Maybe no more than 3 times a day, but every single day, at least once a day. You can repeat this for 3 sets. I like to do about 3 sets of 60 to 90 seconds, or if you're counting repetitions, 3 sets of 10 to 15 reps. You'd repeat exactly the same format for any part of your body. It doesn't matter if it's your arms or your legs.